So I've been waiting for this meeting for 20 years, actually. And it's not that everything's 100% understood or known, but
True.
I think we've made a lot of strides. Wish it was done a long
Actually,
time
good
ago.
idea. This is not financial
Today, we're
advice.
delighted to be joined by America's top medical and public health professionals as we announce historic steps to
Dr.
confront
Oz
the
and
crisis of
RFK.
autism. Horrible, horrible crisis. I want to thank the man who brought this issue to the forefront of American politics along with me. And we actually met in my office, is it like 20 years ago, Bobby? It's probably 20 years ago in New York. I was a developer, as you probably heard, and I always had very strong feelings about autism and how it happened and where it came from.
That is not the heart of the problem here.
The word got out.
I was a developer, and I had
say
really strong feelings about
people were
autism
very
and where it came
understanding
from.
of where we were.
I feel like the
it's turning out
entire
that
press conference is encapsulated
we understood a lot
by
more
that.
than a lot of people who studied it, we think. And I say we think because I don't think they were really letting the public know what they knew. Thanks as well to the director of the National Institute of Health, Dr. Jay Bhattacharya, FDA Commissioner Dr. Marty McCary. These are great people. Administrator of the Centers for Medicine and Medicaid Services, Dr. Mehmet Oz.
Don't take Tylenol.
And Acting Assistant Secretary of HHS,
worse
Dr. Dorothy Fink.
Or expecting
Thank you all. Thank you, Dorothy, very much.
Good job,
The
Trump.
meteoric rise in autism is among the most alarming public health developments in history. There's never been anything like this. Just a few decades ago, 1 in 10,000 children had autism. So that's not a long time. And I've always heard, they say a few, but I think it's a lot less time than that. It used to be 1 in 20,000, then 1 in 10,000. And I would say that's probably 18 years ago. And now it's
just saying.
1 in 31, but in some areas it's much worse than that, if you can believe it. 1 in 31. And I gave numbers yesterday. For boys, it's 1 in 12. I was told that's in California where they have for some reason, a more severe problem.
Yeah.
But whether it's 1 in 12 or 1 in 31, can you imagine? That's down from 1 in 20,000, then 1 in 10,000. And now we're at the level of 1 in 12 in some cases for boys. 1 in 31 overall. So since 2000, autism rates have surged by much more than 400%.
Yeah, I mean,
instead of attacking those who ask questions, everyone should be grateful for those who are trying to get the answers to this complex situation.
Stems, at least.
And the first day all of these great doctors behind me were there, I told them this is what we got. We have to find out.
And we start
because when you go from 20,000
or like I feel
to
some people have been
10,000,
fighting,
and then you go to 12, there's something artificial. They're taking something.
Being impotent as a party.
And by the way, I think I can say that there are certain groups of people that don't take vaccines and don't take any pills that have no autism. That have no autism. Does that tell you something? That's currently.
No.
Is that a correct statement, by the way?
Why?
With the Amish, for example.
The Amish, yeah, virtually. I heard none. See, Bobby wants to be very careful with what he says, and he should, but I'm not so careful with what I say. But you have certain groups. The Amish, as an example, they have essentially no autism. First, effective immediately, the FDA will be notifying physicians that the use of let's see how we say that. Acetaminophen.
Fuck my Chungus country. I'm leaving.
Is that okay?
I'm out of here. Fuck this.
Which is basically commonly known as Tylenol. During pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary. That's, for instance, in cases of extremely high fever.
Oh, my God.
That you feel you can't tough it out, you can't do it. I guess there's that. It's a small number of cases, I think. But if you can't tough it out, if you can't do it, that's what you're going to have to do. You'll take a Tylenol,
Jesus,
but it'll be very sparingly. It can be something that's very dangerous to the woman's health. In other words, a fever that's very, very dangerous, and ideally a doctor's decision, because I think you shouldn't take it. And you shouldn't take it during the entire pregnancy. They may tell you that toward the end of the pregnancy, you shouldn't take it during the entire. And you shouldn't give the child a Tylenol every time he's born and he goes and has a shot. You shouldn't give a Tylenol to that child. All pregnant women should talk to their doctors for more information about limiting the use of this medication while pregnant. So ideally, you don't take it at all. But if you have to, if you can't tough it out, if there's a problem, you're going to end up doing it. The other thing that I can tell you that I'll say that they will maybe say at a little bit later date, but I think when you go for the shot, you do it over a 5-time period.
Oh, nice.
Take it over 5 times or 4 times.
Every time he does this fucking vax shit, like, every time he mentions it, that's probably another parent or another set of parents that say, yeah, I won't vaccinate my kids, or yeah, I'll do some other way of that. Like, and that probably, like, that sentence probably leads to a couple cases of, like, measles, mumps, whatever the fuck.
But you take it in smaller doses and you spread it out over a period of years. And they pump so much stuff into those beautiful little babies, it's a disgrace. I don't see it. I think it's very bad.
No, you prefer to wait till
it looks like they're pumping into a horse. You have a little fragile child, and you get a vat of 80 different vaccines, I guess, 80 different blends, and they pump it in. So ideally, a woman won't take Tylenol. And on the vaccines, it would be good, instead of one visit where they pump the baby loaded up with stuff, you'll do it over a period of 4 times or 5 times. I've been so into this issue for so many years just because I couldn't understand how a thing like this could happen. And it's artificially induced. It's not like something that when you go from all of those, healthy babies to a point where I don't even know structurally if a country can afford it. And that's the least of the problems. To have families destroyed over this is just so terrible. I also, and we've already done this, we want no mercury in the vaccine. We want no aluminum in the vaccine. The MMR, I think, should be taken separately. This is based on what I feel, the mumps, measles, and all the 3 should be taken separately. And it seems to be that when you mix them, there could be a problem. So there's no downside in taking them separately. In fact, they think it's better, so let it be separate. The chicken pox is already separate, because when that got mixed in, I guess they made it 4 for a while, it really was bad. So they make chicken pox. Individually, they're okay. When you mix them, something maybe happens. So there's no downside in doing it. It's not like, if you do it, bad things. No, it's only good side. And it may not have that much of an impact, but it may have a big impact. So let those be taken separately. And then hepatitis B is sexually transmitted. There's no reason to give a baby that's almost just born hepatitis B. So I would say wait till the baby is 12 years old and formed and take hepatitis B. And I think if you do those things, it's going to be a whole different, it's going to be a revolution in a positive sense in the country. The FDA will be updating the label of an existing drug to reflect potential benefits in reducing some autism symptoms. This gives hope to the many parents with autistic children that it may be possible to improve their lives. That's one of the things that I'm very, very happy about. But this was mostly going to be on how not to have the child affected. But we've learned some pretty good things about certain elements of genius that can be given to a baby, and the baby can get better. And in some cases, maybe substantially better. Not going to be easy, but be a lot easier if it didn't happen in the first place, as these great parents fully understand, right? They fully understand. I feel so terribly for. I have so many friends with autistic children. It's a tough situation. Finally, to help reach the ultimate goal of ending the autism fever, the NIH will be announcing 13 major grant awards from the Autism Data Science Initiatives. And to be honest with you, to me, that's the least important. It's not even a money thing at this point. There's so much money, but they have to do, and they have to move quickly. When the alternative is that nothing bad can happen, let's do it now. I was just saying to Bobby and the group, let's do it now. Nothing bad can happen. It can only good happen. But with Tylenol, don't take it. Don't take it.
Dude, he is.
And if you can't live, if your fever is so bad, you have to take one because there's no alternative to that. Sadly, first question, what can you take instead? It's actually, there's not an alternative to that. And as you know, other of the medicines are absolutely proven bad. I mean, they've been proven bad with the aspirins and the Advils and others, right? And they've been proven bad. So I'd like to ask Bobby to get up to the podium and say a few words, and then Dr. Bhattacharya and Dr. McCary, Dr. Oz, Dr. Fink, followed by two incredible mothers that have experienced firsthand what this country is going through, what parts of the world are going through. And I will say there are parts of the world that don't take Tylenol. I mean, there's a rumor, and I don't know if it's so or not, that Cuba, they don't have Tylenol because they don't have the money for Tylenol, and they have virtually no autism, okay? Tell me about that one. And there are other parts of the world where they don't have Tylenol, where they don't have autism. That tells you a lot. And I want to say it right now. And, you know, the way I look at it, don't take it. Don't take it. There's no downside in not taking it.
Fucking retard.
So I'd like to ask Bobby to come up and say a few words. I hope I didn't ruin his day, but that's the way I feel. I've been very strong on the subject for a long time. You know, life is common sense, too. And there's a lot of common sense in this, and I wish things like this were brought up. And this group has worked so hard on it, but I'd like to be a little bit more, a little speedier in the process of a recommendation, because there's no harm in going quicker. There's absolutely no harm. At worst, there's no harm. Thank you very much. Bobby, please.
Thank you, Mr. President. To meet the President's challenge, I ordered HHS to launch an unprecedented all-agency effort to identify all causes of autism, including toxic and pharmaceutical exposures. At President Trump's urging, NIH, FDA, CDC, and CMS are turning over every stone to identify the etiology of the autism epidemic and how patients and parents can prevent and reverse this alarming trend. We have broken down the traditional silos that have long separated these agencies, and we have fast-tracked research and guidance. Historically, NIH has focused almost solely on politically safe and entirely fruitless research about the genetic drivers of autism. And that would be like studying the genetic drivers of lung cancer without looking at cigarettes. And that's what NIH has been doing for 20 years. As a result, we don't have an answer to this critical question, despite the cataclysmic impact of the epidemic on our nation's children. We are now replacing the institutional culture of politicized science and corruption with evidence-based medicine.
Here now than it is
NIH research teams are currently testing multiple hypotheses with no area off limits. We promise transparency as we uncover the potential causes and treatments, and we will notify the public regularly of our progress. Today, we are announcing two important findings from our autism work that are vital for parents to know as they make these decisions. First, HHS will act on acetaminophen. The FDA is responding to clinical and laboratory studies that suggest a potential association between acetaminophen use during pregnancy and adverse neurodevelopmental outcomes, including later diagnosis for ADHD.
What about heroin? How are those
autism.
outcomes?
Scientists have proposed biological mechanisms linking prenatal acetaminophen exposure to altered brain development. We have also evaluated the contrary studies that show no association. Today, the FDA will issue a physician's notice about the risk of acetaminophen during pregnancy and begin the process to initiate a safety label change. HHS will launch a nationwide public service campaign to inform families and protect public health. FDA also recognized that acetaminophen is often the only tool for fevers and pain in pregnancy,
So, okay.
as other alternatives have well-documented adverse
What are the
effects.
downstream effects of this?
HHS wants, therefore, to encourage clinicians to
Will
exercise their
Tylenol
best
not be
judgment
covered by
and
insurance?
the use of acetaminophen for fevers and pain in pregnancy by prescribing the lowest effective dose for the shortest necessary duration and only when treatment is required.
So you have to buy it
Furthermore,
over the
thanks
counter?
to also
Or
to the
will be there
politicization of
will
science,
there be a law
the safety of
against
acetaminophen against the risk of neurodevelopmental disorders in young children has never been validated. Prudent medicine, therefore, suggests caution in acetaminophen use by young children, especially since strong evidence also has associated it with liver toxicity. Some studies have also found the use of acetaminophen in children can potentially prolong viral illnesses. FDA will drive new research to safeguard mothers, children, and families. In addition to a possible
Okay, clarification of what I said earlier on the study. It's not only mothers that had children with autism or ADHD. It's mothers who had their kids tested and had an answer yes or no. Can we figure out why that's bad? Yes. If you're having your child tested, that means you probably have a suspicion. So, of course, there's going to be a skew.
acetaminophen connection to autism for pregnant women, infants, and toddlers. Our research has revealed that folate
Is this how they
deficiency
soft launch the
in a child's
pregnant woman
brain can lead to
database?
autism.
Is that what we're
We
doing
have
here?
also identified an exciting therapy that may benefit large numbers of children who suffer from autism. Peer-reviewed literature has documented that up to 60% of folate-deficient children with ASD can have improved verbal communications if given leucovorin. I have instructed NIH, FDA, and CMS to help doctors treat children appropriately. Jay will help tell that story,
Actual crack
which started with sound science, the kind that restores faith in government. The announcement of this announcement also represents a historic collaboration between NIH, FDA, CDC, and CMS. We expect this to be the first of many announcements over the coming years that deliver actionable information to parents on underlying cause of autism and the potential paths for prevention and reversal.
Maybe.
Finally, autism is a complex disorder.
Actually, I think my parents had me tested, and I don't have it. Or if I do, they didn't tell me.
With multifactorial etiology. We are continuing to investigate a multiplicity of potential causes with no areas of taboo. One area that we are closely examining, as the president mentioned, is vaccines. Some 40 to 70% of mothers who have children with autism believe that their child was injured by a vaccine. President Trump believes that we should be listening to these mothers instead of gaslighting and marginalizing them like prior administrations. Some of our friends like to say that we should believe all women. But some of these same people have been silencing and demonizing these mothers for 3 decades.
That is so
research
sick
on the
to
potential link between autism and
weaponize.
vaccines.
Oh my god. Using the believe all women thing to push your fucking crackpot podcast ass Joe Rogan dick sucking fucking crack science is evil.
Has been actively suppressed in the past.
That'll be a TikTok
It will take time for an honest look at this topic by scientists. But I want to reassure the people in the autism community that we will be uncompromising and relentless in our search for answers. We will perform the studies that should have been performed 25 years ago. Whatever the answer is, we will tell you what we find. We are researching this issue at all 3 agencies. Jay will discuss one of our research initiatives at NIH. This model of unleashing unbiased, depoliticized, gold standard scientific research and academic freedom to deliver actionable information to prevent and reverse disease will be a model for the framework to deliver similar results for many other chronic conditions that plague
Trump's
Americans.
fucking
Okay?
sway.
Thank you, Secretary Kennedy, and thank you, President Trump.
Thank you very much.
I'm proud to announce today that the NIH has launched the Autism Data Science Initiative to turbocharge autism research, devoting an additional $50 million to the cause of studying autism. Nearly 250 research teams from across the country applied sent in their applications and were peer reviewed by the NIH review panels. The NIH peer reviewers chose the 13 best projects focused on root causes and therapies with replication and validation studies to guarantee gold standard science. The studies feature a new kind of science called exposomics, where scientists consider environmental and medical factors, nutrition, events during pregnancy, in combination with biology and genetics to answer vital questions about autism. Science like this, conducted in partnership with families and physicians, is the best way to arrest and reverse the autism epidemic. Autism spectrum disorder encompasses a very wide range of symptoms, ranging from mild difficulties with social interactions to profoundly autistic children who experience severe disabilities in speech and behavior. Given this wide range of symptoms across the spectrum, it seems certain that there will be a wide range of biological contributors to explaining the cause. The great thing about the new NIH initiative on autism is that scientists will use rigorous advanced methods in causal inference, machine learning, organoids, and other fresh approaches to the problem. The sharp rise in the prevalence of autism deserves an urgent response by the scientific community. As Bobby said, the NIH has invested a lot of money to study autism over the years. But the research has not produced the answers that families and parents of autistic children deserve, and autistic children themselves deserve. For too long, it's been taboo to ask some questions for fear the scientific work might reveal a politically incorrect answer. Because of this restricted focus in scientific investigations, the answers for families have been similarly restricted, often pointing families to behavioral therapies that don't work for every kid or suggest non-modifiable genetic factors as the cause. But genetics alone can't explain such a sharp rise in autism prevalence over just a few decades. As
I hate these people.
In coming months and years, as NIH scientists learn more that can help autistic children and their families, we won't delay. Like scientists often like to do. I can say as a scientist myself, it's really tempting to delay.
I'm something of a scientist myself.
In the face of a problem like this, you have to move fast. But we will not delay before telling American people about what we find, and we will win the public trust with transparency and rigor. Already, our broadened focus on autism research has pointed to 2 items that will help families prevent and treat some cases of autism. I'll leave the good news on these 2 items to my close friends and colleagues, Dr. McCary and Dr. Oz. We've been working together closely on this problem for the past 6 months, and our
do you know the Amish people that don't screen for autism don't have autism? Wow. No, they didn't solve autism. They're fucking retarded. They're pointing it to Tylenol when the actual good study on it says, yeah, there's no link. And they're like, it's a scary fucking rise in autism. It's like, yeah, we've been paying more attention to it and diagnosing it better. Fucking fuck these people.
Cooperation represents an unprecedented collaboration with Secretary Kennedy's Department of Health and Human Services and with President Trump. I'm delighted to introduce Dr. Marty McCary, Commissioner of the Food and Drug Administration, who will tell you about these announcements of practical help for families with autism.
Yeah, like no test.
Great, thank you, Dr. Bhattacharya. Mr. President, this is the start of a historic shift in medical culture. This administration is working
now I
together
understand
to
why
ask
people
big
shoot their
questions
fucking TV
about why our nation's children are getting sick
games.
so fast. Too often, medicine is doing small little studies, giving us answers we already knew. But
the entire country of Sweden is a small little
study. Root causes, and we are not going to stop so that we can end the suffering we are watching. And if you've seen a kid with autism, with severe autism, it's hard to watch. Kids get frustrated, they get angry, they can be crying because they want to speak and they can't speak. It's hard to watch, and it may be entirely preventable. For an epidemiologist, that child is an expanding statistic.
Preventable.
But
the most
child,
extreme study said it was like
to have autism. Today, the FDA is taking action to update the label on acetaminophen and sending a letter to all U.S. doctors letting them know about the risks in pregnancy. We now have data we cannot ignore. There's a very large study, the Boston Birth Cohort, with researchers that have from Johns Hopkins, my former institution, and Boston University, found quote-unquote consistent associations between acetaminophen in pregnancy and autism. And the Nurses' Health Study with researchers from Yale, Columbia, and Harvard looking at 9,000 kids found that acetaminophen use in pregnancy was associated with neurodevelopmental disorders. And 4 weeks ago, a Mount Sinai Harvard study reviewed all the existing literature and found the overwhelming body of evidence points to an association.
Looks like he's about to fucking
Sure, you'll be able to find a study to the contrary. That's how science works. But to quote the dean of the Harvard School of Public Health, There is a causal relationship between prenatal acetaminophen use and neurodevelopmental disorders of ADHD and autism spectrum disorder. We cannot wait any longer. And honestly, there's been this perfunctory, reactionary, mindless practice in medicine. I learned it in medical school and residency. Just treat all fevers, low-grade fevers, treat them with acetaminophen. Why? What are we doing? A study out of Hopkins actually showed that treating a fever can prolong the duration of illness in a young kid. Maybe that's because a fever is a body's natural way of ridding an infection. When my wife was
how do they think a fever gets
a few months
healed?
ago,
Doesn't your body
they
cook
pushed her
itself
to take
until the fever goes
acetaminophen
away?
for a low-grade
What the fuck do you think happens to a baby?
She said no, and then they looked to me and I said, absolutely new. I'm also here to announce good news. Today, the FDA is filing a Federal Register notice to change the label on an exciting treatment called prescription leucovorin so that it can be available to children with autism. You know, autism may also be due to an autoimmune reaction to a folate receptor on the brain, not allowing that important vitamin to get into the brain cells. It's a fairly established, mature pathway. Again, we have a duty to let doctors and the public know we are going to change the label to make it available. Hundreds of thousands of kids, in my opinion, will benefit. One study found that with kids with autism and chronic folate deficiency, 2/3 of kids with autism symptoms had improvement, and some marked improvement. Mr. President, you told us to do what's medically right, to go bold.
Is this just exactly what fucking happened with the vaccine study in England all those years ago?
And not worry about the corporations and the lobbyists. So that's what we're here doing today. Thank you, Mr. President.
Good, thank you.
Thanks, Marty. I think you all appreciate the passion in the president's voice. We've been hearing that since the inauguration. In fact, even before
the passion
the
in his
inauguration,
voice,
the president was upset about what he spoke to today. And so together with Secretary Kennedy, who's made it his life's work to address some of these challenges with autism, they challenged us. In fact, they were harsher than that. They wanted no silos to break down what the NIH would do, what the FDA would do, what CMS would do. They insisted that the physician leaders bust through the clutter because their agencies had the power if we didn't do what every other prior administration had done, which is to let people function within their siloed environments. Because of that, in historic fashion and a very accelerated manner, we have a response today to the autism crisis.
They're announcing
it is the
an
first
autism
of several
rate
chapters, but this is breaking news. You've heard some of it. The response to the autism crisis is going to continue to come to you under Secretary Kennedy's leadership, and the president wouldn't have it any other way, as you've heard. The FDA, based on NIH research, is approving prescription leucovorin for treatment of autistic children. Now, if you're following the script, there should be two questions that you have, two questions that should come to your mind. The first is, how will patients and parents get access to the treatment?
I think Tylenol,
I'll tell you
if I'm
how.
not, I could be completely wrong. Also, welcome to the stream. Tylenol is just what we call it, and I think you guys, I'm assuming you're English, I think it's the same thing. I could be wrong. If it's acetaminophen, it's acetaminophen.
Over half of American children are covered by Medicaid and CHIP, government health insurance. Over
Not
half.
anymore. Maybe. I don't know.
And therefore, because they're covered in Medicaid and CHIP, upon this label change by Marty, state Medicaid programs in partnership with CMS will cover prescription leucovorin around the country. It's yours, but you have to go to a doctor to get a prescription because they know your child, they know you, and they know the medication. States will also have tools to monitor its use and ensure appropriate utilization. That's important for a bunch of reasons because we want the right kids getting the right prescription medications.
Yeah,
we believe
I know,
private
right?
insurance companies will rapidly follow our lead if they have not already done so. And again, to make sure that this is safe and effective treatment, you need a physician to prescribe the medication because it's on prescription.
They're saying
Second
folic
big question.
acid cures it.
How are we going to collect clinical data to answer the big questions that the president's asking and the secretary insists that we offer? CMS is also issuing guidance to convene states and existing research networks to support NIH and FDA in their research efforts of prescription leucovorin, while also maintaining the privacy of all patients, all health information of our beneficiaries. Collecting real-world data, which is what many of you have been asking us to do in the community, is fast It is life-saving, and we'll get answers based on what happens over the next few months with this approach. The aggressive approach, and it is aggressive, demanded by the president and by the secretary, have already identified risk factors and opened the door for the first FDA-recognized treatment pathway for autism. It is the first of its kind, and it wouldn't have happened without the leadership of the president and the secretary. The five-fold increased prevalence of autism over the past 25 years demands a rapid response. The average clinician, researcher, we spoke to many, thought it would take 5 years to get this data. Parents are unwilling to wait 5 years. The president is unwilling to wait 5 years for these results. So the president and the secretary are acting today with this tri-agency move. The administration's bold actions investing in groundbreaking research follow the science, they restore trust, which has been lacking, and they will change the trajectory for millions of American families. Mr. President, God bless you for being brave.
God.
So let me introduce Dr. Fink, who's acting administrator, and after Dr. Fink, we've got some wonderful women, Jackie and Amanda.
I don't know, what do you even fucking
I know
say
it's
to
gonna be
this?
tough,
It's
but
just
if you
so
can make some
patently
comments about this
fucking
historic
stupid.
day. God bless you.
Thank you, Mr. President, for this opportunity to speak with all of you.
I'd rather eat Klaus Schwab's
As a
fucking
pediatrician and mom,
bugs.
I'm here today to talk about what this announcement means
I thought it was
for the millions
Richard
of
Fink
moms
from
and
the
dads
chemtrails
who are faced
conspiracy.
with the choice of whether to take acetaminophen during pregnancy. It's hard to hear information that challenges the status quo. We are sharing this information not to confuse, but to empower parents to make the best choices when taking medications during pregnancy. We are all concerned about the rising rates of neurodevelopmental disorders, including autism. President Trump and Secretary Kennedy are dedicated to radical transparency so that patients have the best, most up-to-date information. We are also sharing this information with our nation's doctors, and we encourage you, as always, to consult with your doctor to make the best decision for you.
To Europe so that I
All
can
too
say what I
often,
wanna fucking
it's easy
say.
to think that medicines we buy without a prescription pose little to no risk for the mom or the baby. As you heard today, pregnant women who need high fever or pain reduction during pregnancy should take the lowest effective dose of acetaminophen for the shortest possible duration. Most women will not meet these indications during their pregnancies. I am encouraged by these developments today because it is another example of our commitment to the American people to leave no stone unturned in improving the health of our nation's
RFK
children.
probably genuinely believes it.
Next,
Trump
I'm going to turn it over
genuinely
to some
believes it.
incredible mothers who are going to share
Oz,
more
I
about
don't
their
know.
stories, and we're so grateful to have you here today.
Come on.
Thank you. Thank you, Mr. President and team, for all your work. This is an historic day, and I'm thankful to be here. I have a son who's 5 who is profound.
And it sounds fucking mean to say, but like the vaccine shit, this shit comes from people having kids that have autism and them not wanting, being unable to accept the fact that it's just a thing that can happen. I have to find something to blame because it feels bad that it's just a thing that happens. It's a lot easier to point the finger at a scapegoat than just accept that something bad happened. It sucks.
Profoundly autistic, and you've probably heard if you've met one autistic child, you've met one autistic child.
They probably don't. If they don't have Tylenol, they probably don't fucking
I don't
test
think
for
the spectrum
autism.
is helpful, but that's another
Look, in the
conversation.
U.S., we test a
Um,
ton for autism. They're
he
talking
is
about,
an amazing
was
little
Cuba.
boy.
and I would
blessing
imagine Cuba
from God.
has an acetaminophen equivalent. Right?
He's marvelous. He can
I can
count
look
to
into it,
1,000.
but-
He knows all of his letters and the sounds they make and a word for each one. But he also has a lot of obstacles. He is nonverbal. He can say those numbers and letters, but there's no communication. Unless you've lived with profound autism, you have no idea. You have no idea. He, like you said, he will get frustrated because he can't
They
speak.
might require a fucking prescription.
It's not even that he can't speak. Sometimes he just doesn't understand what I'm saying. He understands the word no,
The rattle
but he doesn't
go
understand the
left
why
goes
behind the no. And that's a huge part of discipline. That's the discipline. So it's very hard to discipline a child with autism so you have these behaviors. And it's a very hopeless feeling. It's very isolating being a parent with a profound autistic child. Even just taking them over to your friend's house is something we just don't do because, again, they're going to be met with no, 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 and no understanding of why. And then there's a meltdown. And then you're in a situation where you're just helpless and you're just trying to protect your kid. So it's just better not to do it. You learn your limits, and it's been really hard. This is amazing that we're here today. And no one has been able to point to anything to say, this is what caused it. And you can't point to that and say, it didn't cause it. I have no idea. I am completely open. I'm not blaming anything, but I'm open to the discussion and the fact that there's work being done to find answers. I'm very grateful.
Don't say that.
I was already excited to vote for Mr. Trump anyway, as
Yeah, unless
president.
I'm mistaken.
But when we got word of RFK
autism
doing
is
his work, I
kinda
was
from birth?
ecstatic. I could not wait for this work to be done, that somebody would try to find us.
Okay, this is going to be a very harsh thing to say, and it's not going to sound great, so don't clip it. Is a mother of a kid with severe autism, which apparently, according to Trump, gives her a PhD and a full research background in it. Just like, yeah, none of us are sitting here saying, yeah, severe autism is epic and based. We should have more of it. But,
some answers. I'm just very grateful. I pray for my son every day and hope that he can get the help that he needs. And just thank you.
Thank you.
Thank you very much.
makes sense to me.
Hi,
Yeah,
my
I
name is
still have it.
Jackie. I'm also extremely grateful
A lot
for the
more
opportunity
people are
to
on
be
it?
here
Yeah, send it in the Discord.
and share my son's story. My son is Eddie. He's 11. He's on the opposite end of the spectrum from what Amanda just explained. He's considered high
Wait, so he's Omega not autistic?
functioning.
So, no, never mind.
He was not always high functioning. He was nonverbal till the age 4. We've had quite a hard time to get to the place where we are today. I am just so grateful to President Trump and the entire administration
Son
for
used to be autistic, and then I
finally
gave
listening
him
to
folic acid.
moms who have been crying out for help, for answers for years. I've met so many other moms with children on the spectrum in the 9 years since my son's diagnosis, and they all have very
Such a
similar
dick
stories.
being a dude
And they've
here,
all
like,
just wanted
yeah,
somebody to listen,
fucking- you don't know what
to
you're
not
talking
ridicule
about.
them or
It's not a good
look
look.
at them like they were the crazy people. It's hard when you don't have doctors that take the time to really listen and find out when the change happened and what change happened. And it's just, I've been praying for this day for 9 years, and I'm so thankful to God for bringing the administration into our lives. And
Right,
I am
right
just, I'm speechless. This day is a day I never thought would happen. I thought that we would never have an administration that was courageous enough to look into things that no prior administration had. So I'm just here to express my gratitude, and I am looking forward to what comes from this, and hopefully we just get more answers. So thank you.
Thank you very much.
I can't believe they didn't mention 5G in this.
So I just want to say acetaminophen is basically Tylenol, essentially, because I noticed that term is used throughout this conference. So it's essentially Tylenol.
Retarded.
And I just recommend strongly that you don't use Tylenol unless it's
Yeah,
absolute.
wait, I'm sitting here saying, yeah, it feels bad. It's just like a dude that's not a mother, doesn't have kids, like, commenting on this, and then the fucking president does. So, like, whatever.
necessary. I understand it's maybe 10% of the women that are pregnant.
Yeah, they're still
are,
covering up for the Epstein
would
shit.
perhaps be forced to use it. And that would mean
And the real crime of
you just
firing
can't tough
Jimmy
it out.
Kimmel.
No matter what you do, you can't tough it out. So that's up to you and your doctor. But there's a very strong recommendation,
Jimmy Kimmlers.
maybe stronger from me than from the group, because they're waiting for certain studies. I just want to say, I want to say it like it is. Don't take Tylenol. Don't take it. If you just can't, I mean, it's fight like hell not to take it. there may be a point where you have to, and
hold on.
that
I just
you have to work out with yourself. So don't take Tylenol. Other things
let me look up something.
we recommend, or certainly I do anyway, is
didn't mean caps.
and it's so important to me to take see the doctor 4 times or 5 times for a vaccine.
Kenvue.
Don't let them pump your baby up with the largest pile of stuff you've ever seen in your life going into the delicate little body of a baby. Even if it's 2 years, 3 years, 4 years, you just break it up into, I would say 5, but let's say 4 visits to the doctor instead of 1. And certain things I think you should do. We've already taken out and are in the process of taking out mercury and aluminum now. You know what mercury is. You know what aluminum is. Who the hell wants...
The data to support this is bullshit. There's a study that Sweden did on its entire country that said there's no fucking correlation, if not a negative correlation. But the studies they're citing are huge confirmation bias bullshit.
That pumped into a body. And there were rumors about both of them for a long time. But we're having them taken out. We're having them taken out of the vaccines. Hepatitis B, again, that's sexually transmitted. And we think you should wait. I think you should wait till 12. You know, I'm just making these statements from me. I'm not making them from these doctors, because when they talk about, you know, different results, different studies, I talk about a lot of common sense, and they have that too. They have that too, a lot. But I recommend the hepatitis B.
I want to see if
take it at 12. Sexually transmitted. You don't have to give it to the baby when the baby's 2 years old, and there are a lot of theories on that, but not when they're 12. It's not. Doesn't seem to be a problem at all. The MMR and the chickenpox. Chickenpox has already been broken out. It's a singular shot, but the MMR is not. And I've heard for years that there's a problem with it. But they say that there's no problem if you do each shot separately, not put together. So an MMR, go out and do it separately. Don't take Tylenol. Don't give Tylenol to the baby after the baby's born. Every time the baby gets a shot, the baby gets a shot. They say, here, take a cup of Tylenol. I've heard that for years. Take Tylenol. Don't take Tylenol. Don't have your baby take Tylenol.
I was trying to see if he had said something like
now, Tylenol is fine for people that aren't pregnant, that aren't in the situation that we're talking about. One very specific situation. If you're pregnant, don't take Tylenol. When you have your baby, don't give your baby Tylenol at all, unless it's absolutely necessary. Don't do it. Break up your visits to the doctors. Break them up. Do it in 5 if you can. Now, it's inconvenient. It's inconvenient. Oh, you got to have to go back another year later. You're going to go back
Dr. Trump.
each year for 4 years, 5 years, 3 years. Just break it up. Break it up, because it's too much liquid. Too many different things are going into that baby at too big a number. The size of this thing, when you look at it, it's like 80 different vaccines and beyond vaccines, and 80. Then you give that to a little kid. I mean, I can tell you that I had a woman who worked for me, a beautiful, wonderful woman, worked in Trump Tower, and she had the most perfect child, beautiful, just perfect. And I remember this little blonde-haired boy running around the lobby of Trump Tower, so healthy and so vibrant.
It was me.
And I said, that's great. And one day I came in and she was crying her eyes out behind the counter. She worked at the front desk. She was crying her eyes out. I've never, as much as I've ever seen anyone distraught, she was.
Oh, no.
I said, are you okay? What happened? My boy, I've lost my boy. What does that mean, your boy? My boy.
That's
you know
the part you're
sir,
confused
you've
about.
Seen him grow up. He was so beautiful. And I took him for a vaccine, sir. And he developed this unbelievable, I think she said 107, 108. You know, it goes well beyond when this happens. It goes up to 106, 107, 108. You know, we hear 105 and you're in trouble, but it just goes up to a level that you never hear about, but it goes up very high.
RFK
And
looks Liberty Switcher. RFK looks like he's about to fucking pop.
She said, I took him, he got developed
He's so
an
red.
unbelievable temperature. And I've lost him, sir. He's gone. And then I saw the boy. It was so tragic to see. That was the following day. That was the following day after the vaccine. And I've seen it 2 other times, and I think 3 other times, but 2 other times, where they go to the doctor and they get the vaccine, they get the shot. The kid is, badly hurt. Let's be nice, badly hurt.
Wow,
and
2 times out of
just do
your
it. Break it
entire
up into
life?
5. Break
Seems
it up
like a
into
pretty
4.
low
Break it up
fucking
into
rate.
3 if you have to. But go to the doctor 4 times instead of once, or 5 times instead of once. And for some reason, they insist that you put it all into the body, and maybe that's the drug companies that make more money that way. Maybe it's the doctors because they don't want to be.
Or if they can do it one by
doing
one.
this so much. Maybe it's the doctors. They get maybe more money. Who the hell knows what it is? Don't do it. Get them broken into 4 or 5 visits. Do it 4 or 5. That means you have 20%, 25% what you're putting into the baby's body. It can only help. It can only help. And the other things I told you about, just the word tough it out. It's easy for me to say tough it out, but
Who knows what's up?
sometimes
Just
in
don't do
life
it
with a lot
right.
of other things, you have to tough it out also. Don't take Tylenol. Don't give Tylenol to the baby. When the baby's born, they throw it at you. Here, give him a couple of Tylenol. They give him a shot. They give him a vaccine. And every time they give him a vaccine, they're throwing Tylenol. And some of these babies, they're long born, and all of a sudden they're gone. And it doesn't hurt not to do it. It doesn't hurt. There's no downside.
The downside is a fever that can actually lead to very severe consequences.
Downside at all. And break up MMR. Break it up. It's practically a known fact that if you break it up, you're not going to have a problem. But for years, we've been hearing how bad MMR is as a combination. And I'm very happy that you broke out chickenpox, because that was really a problem.
Yeah,
And there are other
if they
things. It's
identified a
interesting because there are
problem, they
other
would've
things,
fucking done it.
we were talking about it, other different drugs, pills that you
sorry,
take
no.
that we know are so bad and they don't take them anymore. But for some reason, with this, they keep taking it. Don't take Tylenol. There's no downside. Don't take it. You'll be uncomfortable. It won't be as easy, maybe, but don't take it. If you're pregnant, don't take Tylenol. And don't give it to the baby after the baby is born. And you know what? We have
Thanks to God, Emperor Trump.
more than 3 years left. And I told Bobby and the doctors behind me, and they are so committed to this, I told them that this is the number one thing I want to do from you. And we have something else called favored nations, where I'm going to be reducing drug prices by 1,000%. By 900, 600, 500, 1,200. We're going to be reducing drug prices at levels never seen. It's called favored nations. We're going to be paying what right now, we're like the garbage can for the rest of the world, and we have been for forever. We pay much higher for drugs than the rest of the world.
autism
We
has
subsidize the rest of the
completely
world. We're not doing that
eradicated as of
anymore.
now.
And that's
You
a
are
big
brave
thing.
and
That's a big
fearless
thing.
leader.
That's bigger than anything. I told the story the other night that I was so proud in my first term that for the final year, drug prices went down 0.25%, and I was so proud. I said, why? I'm the first one to do it. I think it was 28 years, they said, where drug prices went down from the beginning of the term to the end. And I was so proud. I called a news conference. I said, drug prices have gone down. First
Trump
time it's
bragging
happened in
about us?
28
No,
years. You know what it was? 0.25%. I was so proud. Now we're going to have them go down from $100 a pill to $9 a pill. From
It's not
$1,300 for
That's
a
the
shot
thing.
of like an Ozempic or the fat. I
Even
call it
the
the fat
most-
pill or the fat
the
drug.
highest correlation.
Sometimes it
studies
works, I
are
guess, for
not,
people. The ones I've seen, it hasn't
super
worked so well.
strong.
I got a lot of friends, they're fat. They said, I lost some weight. I said, you don't look it to me. But they paid $1,300, $1,200, and they go to London and they pay $88. And they call me, they go, what's this all about? we're subsidizing the rest of the world stupidly because we have a lot of stupid people in this country running things. And how big is that? But to me, that's nothing compared to autism. I see that gorgeous boy. I have a big present for him in the back. You know, you bring him back. We're going to bring him into the Oval Office. I have the best present he's ever going to get, okay? A big one. I saved it for you, okay? Because I heard you were coming. Look how beautiful he is. So that's it. There's nothing much to say. Don't take Tylenol if you're pregnant, and don't give Tylenol to your child when he's born or she's born. Don't give it.
Yeah.
Just don't give it. And we're going to have, I think, really, if you do all the things that I say, break it up. Just break it up. Break up the shots with the doctor. MMRs, as I told you, separate.
All right.
Chickenpox already separate. You do these things. I'm telling you, I want to, when I leave office,
Okay.
I don't want to have,
looping around in circles,
it's going to be the kind of number that we're hearing where it's 1 in 32 or 1 in 10, because I've heard 1 in 10
I'm
also.
probably going to wrap up after this.
And in California, it's really bad.
This
I want it to be, let's get it back to maybe 1 in 10,000 or 1 in 20,000 or maybe none in 20,000.
None
and the only way you're going to do that, because this is
they are
artificially
claiming
induced.
to have
This
cured
is induced by something. You don't go from 1 in 20,000 to 1 in 10,000, then to 1 in 10. That means you're taking something and something's wrong.
Just out of curiosity.
And I feel very certain, and I know I'll be criticized. Someday they'll look back and they'll say, well, it wasn't, but I think it will. I think we're going to have a tremendous, this is the most important thing. There's nothing more important than me. We cured inflation that Biden gave us. He gave us so much inflation, the biggest ever in history. We got inflation done. We brought prices down. We gave you the largest tax cuts, all that stuff. It doesn't mean a thing compared to what we're doing today. This
means
everything.
We would have seen the largest jump when
we're gonna
Tylenol was introduced.
Save a lot of children from a tough life.
Unless it took them
really
45
We're
years
save a lot
to start
of parents
using
from a tough life.
Tylenol.
Okay, how about a few questions? Let's just make it on this subject. This is so beyond as a subject that I'd rather not talk about, some nonsense on the economy. And I will say this, the economy is unbelievable.
Okay,
the stock market just hit another record high and all that stuff. This means more to me. Yeah, please.
Mr. President, I have one on your announcement, one on vaccines that's also related.
Yes.
Why do you think we haven't heard more previously about the tie to autism and acetaminophen?
Nobody knows. I don't know. Not only that, when you say it, you get attacked.
Fuck, what am I looking at?
I was saying something similar, not as strongly, because now facts are on our side. But I was saying it with Bobby 20 years ago, and I was attacked. I said, whoa, what was that all about? I had no idea. You get attacked. I don't know.
There it is.
The medical community, the drug companies, doctors. I don't know what it is. All I want to do, I don't care. I don't care about being attacked. It doesn't matter to me. I believe that the numbers at the end of our term or shortly thereafter could be really phenomenal. I want it to go up just like it came down to this horrible level. Okay. 1 in 10, 1 in 12. I was told.
Okay. I got to run. I got a meeting.
1 in 10. I was told 1 in 12. Today I heard 1 in 31 if you add.
Thanks everyone for stopping by.